Hi, I'm Dr. Dave Candy, and welcome to our weekly Friday Fix. This week we're going to be fixing up a really common physical therapy exercise. And if you've been following our blog for a long time, you'll know that I really don't use a whole lot of exercises in my practice. But this is one that it's common. I think it actually is a good exercise when done right, and a lot of people do it wrong. So if you've ever had any type of physical therapy for your back, your hips, your knees, you've probably seen this exercise. And likewise, even if you've just Googled exercises for back pain or hip pain or knee pain, you've probably also seen this exercise. And what the exercise is, it's called the clam or the clamshell, or if you want the technical name, the side-lying hip external rotation exercise, but most people know it as the clam. And essentially, you lay on your side and you separate your knees like a clam. So here is the way that people typically do that exercise, and then I'll tell you what's wrong with that, and then kind of the best way to do it in order to best focus on your hip external rotators, which is what it's designed to work on. So here's the typical way that people do it. They lay down and they put their knees together, which is a good starting position. Now notice you're already kind of knee together or adducted with your thighs. And it's fine if you want to start there. It's really no biggie. If you want to put a pillow in between so that you're starting from a neutral position, that's great too. It just helps you avoid that knee together position. But starting in this position, a lot of people will do this. And they'll go back and forth like that, getting a lot of motion in their trunk, doing 20, 30 reps of the exercise. And when that gets easy, which it's easy, you can do it all day long, then they start adding bands or resistance or other forms of weight or things that they can do to make it more difficult, and then keep doing that. But if you do the exercise correctly, working on the muscles that it's actually designed to work on, the hip external rotators, they're in the back of your hip. There's 6 of them. Your piriformis is one of those. That's typically the one that gets all the bad rap, but they all kind of work together. And you want to roll forward enough that those muscles are on top. That if you roll back like this, you can use your tensor fasciae lata muscle, it's called, or even your hip flexor muscles a little bit to help you to be able to open your knees up. So you want to start out rolled forward. Make sure you stay there and you're not rolled or twisted too much with respect to your spine either. So you've got your spine in a good alignment, your hips rolled forward, and then put your hand on here and put it so that you've got some fingers on your back and some fingers on your bottom. And that way, when you start doing this, you can actually kind of feel the movement. And you can tell that you're moving more than just your head. So keep yourself rolled forward, use that hand to monitor movement, and then just slightly open your knees. Now, you'll notice that that's not a ton of movement, but that's really okay. That in everyday life, and if you think about the practical purposes of this, we don't walk around with our legs like that all day long. It's just not very common that we have our legs out that wide. What this is designed to do is keep you in a neutral alignment and not let you fall inwards. So we really need to only open about that wide. And that's enough that you can actually feel, and you should feel, a muscle contraction in your hips. That you can see it, and you can probably even visibly see the muscles contract a little bit. Now, that's really all you need to do. It helps sometimes to focus on that contraction and hold it there for a few seconds. And even if you just do maybe 5 or 10 repetitions, holding for 5 or 10 seconds each, and really trying to key in on those muscles, activate the connection between your brain and the muscle, that's going to do a lot better in the long run than 50 or 100 mindless repetitions where you're really not thinking about it, you're really not connecting your brain to anything, and you're really not probably working the correct muscles either. So in review, just the correct technique: roll forward, hand on hip, keep yourself rolled forward, don't let yourself twist here, slight separation of the knees, hold for 5 to 10 seconds, and then return. And then just go until you get tired and you can't really do any more without good technique. Now, while we're laying on the side, a lot of people do a progression of that exercise where they do this. And that also is a good exercise. But the same points apply, that if you're moving a lot from the pelvis and you're either rolling back like that, or you're allowing your pelvis to hike up and you're getting movement here, you also don't want that. So same technique, roll forward, almost start out with the clamshell, straighten your knee, and that's about all the higher that you really have to go. And you should feel that good contraction in the hip muscles. You should generally keep your toes rolled upwards, or at least trying to roll them upwards, and then holding 5 to 10 seconds, and then return.